The goal of this movie is to demonstrate the procedure of our new approach to patients with ovarian dysfunction. Ovarian function declines progressively during aging, and some pathophysiological conditions, including karyotype abnormality, autoimmune diseases, chemo and radiation therapies, and ovarian surgeries. Most of middle-aged women with a low ovarian reserve showed poor ovarian response to ovarian stimulation for yielding mature oocytes. Furthermore, young patients with a low number of antral follicles also showed poor ovarian response to the ovarian stimulation. Fertility preservation is important to save the potential oocytes for future pregnancy. For fertility preservation, oocyte cryopreservation was established. However, these poor ovarian response patients could retrieve a very limited number of oocytes, even after proper ovarian stimulation, leading to the requirement of repeated expensive procedures to ensure a sufficient number of oocytes to guarantee one baby. To solve these issues, we have recently developed the in vitro activation, IVA procedure, which enables us to stimulate the early stage of ovarian follicles to develop to preantral follicle stage. The original IVA procedure can promote primordial, primary, and secondary follicle growth by ovarian cortex fragmentation, leading to hipposignaling disruption. This is then followed by 2 days of culturing with AKT signaling stimulator. This procedure is suitable for POI patients with few residual follicles. However, this procedure is an excessive treatment for the patients who have multiple secondary follicles.